Hello once again and welcome to Clinical Next with Dr. Abosede Adegbite. I trust you are keeping well. Today let's talk about this. Can you identify this? This is common salt, the cooking salt. Is it a friend or an enemy? Earlier this week, I saw a patient who had low blood pressure. Her blood pressure was ranging between 70, 30, 60, 40. So each time she had that low blood pressure, she would feel dizzy and feel like fainting. But she would then add salt to water, drink it, and within a few hours, she will feel better. By the time I saw her, her blood pressure had normalized. So that tells us that salt is an essential part of our nutrient. And the active ingredient in salt is sodium. So sodium is an essential mineral for health. When people lack sodium, usually some of them feel nauseous, they feel dizzy, some feel unwell. Some have severe headaches. Depending on how low the sodium is in their blood, some can convulse or go into coma. So it tells us that sodium is essential for our health. So what are the benefits of sodium? It helps to maintain a healthy blood pressure. It also helps to optimize the function of our muscles and nerves, and to boost hydration and maintain fluid balance in the body. Without salt, without sodium in the body, we will probably not be able to retain any water. But sodium helps with fluid balance, like I said. So it has a lot of benefits. But this same sodium can, when it is taken excessively, cause high blood pressure. Imagine that lady that adds salt to water and drinks. Now I said her blood pressure is normal. Imagine that she now takes it every day, or she adds that amount of salt in her food, that amount of extra salt in her food every day. What will happen to her blood pressure? It will not remain normal. It will rise above normal to levels that we call high blood pressure or hypertension. And ultimately, she will need treatment for high blood pressure. So what it means is that even though salt is beneficial, it is also problematic when we take it too much. And there is need to strike a balance. And that is what we'll be discussing today. High blood pressure, heart diseases, stroke, and kidney failure. Those are the risks involved in taking too much salt. And we don't want those. So what is recommended? The daily recommendation is 5 grams of salt, and this is 5 grams, level teaspoon, not a heap and not tablespoon. Teaspoon, small spoon, level, not a heap. If you take a heap, you have taken much more than what is recommended for per day for you. So in that 5 grams of salt, we have 2,300 milligrams of sodium, but for healthy adults only. For children between the ages of 9 and 13, they are required to take 1,800 milligrams of sodium. Children between the ages of 4 and 8 are to take 1,500 milligrams of sodium per day, maximum limit. And for adults who are hypertensive, 1,500 milligrams. That is about 2/3 of that, meaning that they will just be adding a pinch of salt in whatever they cook. And for children between the ages of 1 and 3, just 1,200 grams, about half of that. In reality, what has been happening? A lot of people have been taking much more than what is recommended. Let us take 70 grams of noodles, for example. I was looking at the label this morning and I saw 1,180 milligrams of sodium, and they wrote 49%. 49% of daily intake, meaning that the average person takes 2 of those and they use the 2 seasonings that accompany them. That means that you have taken all your sodium intake for that day if you use the 2 seasonings. And what if you add maybe a sausage, a finger of sausage, or a link of sausage? If you do that, you can have up to 500 to 1,000 milligrams of sodium in each of them. Clearly, you have exceeded what you should take per day in one meal. No wonder we are having hypertension in the young and a lot of adults coming down with high blood pressure. This week, I still saw a 20-year-old that is hypertensive. A 20-year-old shouldn't be hypertensive. So when I asked him, do you eat noodles? He said, yes, a lot. And he likes that seasoning a lot. So before we breed families that are all hypertensive, let us curb our sodium intake. Because what it means is that many of us are taking times 2, times 3, times 4 of what is recommended. So what are the tips to help us to reduce the amount of sodium we take? Quite a number of them, about 8. Number 1 is to cook your own food. If you cook your own food, you'll be able to control the amount of salt that you put in your food. So number 2, use flavoring alternatives. Use herbs and spices. Garlic, ginger, turmeric, rosemary, oregano, and other herbs. They will enhance your taste as much as some of these seasoning cubes. Some people will say, I don't use salt, but they use a lot of seasoning cubes. Sodium is still contained in this seasoning cubes. So it may be contained in lower amount, but there is still sodium in it. So we have to be careful. So why not choose non-salt seasonings? Number 3 is that we should look at food labels. When you go to buy anything, begin to look at the labels. How much of sodium is in it? How much of calories? How much of cholesterol? And choose the healthier options, those that are lower in sodium content. For example, if you want to buy sausage and you have 3 brands, you can look at the sodium content and choose the one with the least sodium content. It will help. Number 4 is to avoid eating out, to avoid eating fast food. You may not be able to avoid it completely. It may be impractical. Children may want to go once in a while. Even adults, may be famished and you don't have any other option. But let us limit it, because all they care about is great taste and not necessarily your health. But you are the one who cares a lot about your health. So limit and, if possible, avoid buying fast food. Number 5 is to rinse out canned food, and that way you'll be able to reduce the sodium. So if you open a canned food, you may want to, maybe peas or tuna, you may want to drain it first and then rinse with cold water so that you reduce the amount of sodium in it. Limit processed meat. Processed meat, like sausage, has a lot of sodium content. This morning when I was looking at the labels, I saw as high as 950, 1000 milligram of sodium in just one finger of sausage. So it is important that we, limit processed meat. And then choose food that are natural. They are richer in potassium, magnesium, and calcium. These are healthier salts that help us to bring our blood pressure down, because they relax the smooth muscles of the vessels and therefore causing the flow of blood to be easy. And once the flow of blood is easy, then the blood pressure comes down. Potassium naturally counters the effect of sodium on the body. You get potassium from green leafy vegetables, bananas, potatoes, sometimes white beans, kidney beans, tomatoes, and other fruits. So why not let us eat more of those natural things rather than wait for, the canned ones? So these are tips that can help us to limit our sodium intake. However, gradual reduction is the key. Let us ease into healthier diets. You cannot go from 100 to 10. Your husband and your children will complain. So as a mother, please do it gradually. If you used to use 4 cubes of seasoning before, then please reduce to 3. And then next month, you reduce to 2. And then the month after, you reduce to 1. That way, everybody's taste buds will adjust gradually. And for daddies and children, please understand with mommy. It is not that mommy no longer knows how to cook, but she needs to factor in your health and, bring out the healthier version of you. So mommy will be cooking with less salt and less seasoning. That is why everybody in the family should watch this together. That will make them to understand why there has been a change in the taste of the food. And then mommy will be using more herbs now and other spices rather than salt and seasoning cubes. So please show understanding. Let us always remember that good health is great wealth. Anything that we can do to enhance our health is what we are discussing on this program, and it will benefit us. So if there is anybody you care about, please share this video with them. It is important. And I want you to subscribe and turn on notifications so that you will get notified once we upload videos. And do not also forget to put your comments and your questions in the comment section or on the WhatsApp number showing on your screen. I'll make an attempt to answer them. So see you next week, God willing.